What to expect on the day of a kidney biopsy. Before a kidney biopsy is planned and scheduled, the care teams often have a discussion with the patient about the indications, the safety, and the risk profile of the procedure, and an informed consent is taken beforehand. On the day of the biopsy in the morning, you might have a blood work and a urine test to make sure your blood cell counts are good enough to proceed with the biopsy and there is no urine infection going on. And for the actual procedure, you would be asked to lay on your stomach with face down for about 20 to 30 minutes. The actual procedure takes about 5 to 10 minutes, but it's just the time taken to make sure the position is correct and patient is comfortable for that position for the time of the procedure. For the pain control and the numbing part, the local anesthesia is given, and that is usually good enough for most patients. However, certain patients, if they need to have a little bit of more sedation, then our anesthesia team could help with that. But it's important to remember that during the procedure, we do want our patients to be able to follow command. For example, we would often ask them to take a deep breath and then hold before we take the actual sample. 2 to 3 samples are taken to make sure we have enough good of a tissue that will be processed to know what's going on in the kidney tissue. And after the procedure, you would just leave with a little band-aid on the back and will be observed in an observation unit for about 2 to 4 hours to make sure your health stays okay. And the things to watch for after the procedure would be including if you have any blood in the urine or you have any unusual pain that is persistent and not getting relieved, let's say with just Tylenol, or if your blood pressure drops, or if there's visible bleeding at the site of biopsy. However, in general, this procedure is very safe, and the observation period helps us to observe the patients further for any deterioration. The results of the biopsy would take normally from 3 to 5 days because the tissue needs to be processed into thin slices and then stained with different stains and colors, then seen under a microscope and also under an electron microscope to see what's going on in the kidney. And once the results are available, the care team would communicate with you and would facilitate the further treatment options. Thank you.